This is a presentation to meet the integrated learning experience requirements for the University of Florida's Master of Public Health program. This is about ransomware and hospital networks. The objectives here in this presentation, I will cover some statistics and incidents to show why cybersecurity matters. I will then provide some data from the U.S. Department of Health and Human Services Office for civil rights, the breach portal. The portal is a listing of all the different breaches of unsecured protected health information as reported to the Secretary of Health and Human Services. Next, I will define ransomware and introduce FEMA's four-step disaster management model. Using best practices from peer-reviewed journals, I will outline the steps that hospitals should use to protect themselves from a cybersecurity disaster. And finally, I will compare two case studies and their respective results. In 2022, ransomware affected almost 300 hospitals across 24 healthcare networks in the US alone. In fact, 70% of these attacks were successful in exfiltrating protected health information or personally identifiable information, which is to say transferring or stealing the data without authorization. To date, there's been a single fatality in Germany that was linked to ransomware. The patient passed away due to the delay in receiving care as her ambulance was redirected to another hospital. The emergency department at Dusseldorf University Hospital, which was her original destination, was forced to close when a ransomware attack restricted access to healthcare data. In another incident, a child received 5 times their prescribed dosage of a steroid and Tylenol that was Tylenol with codeine due to the staff's inability to review his medical record to calculate the proper dosage. Moreover, in a different example, in a blatant attempt for money, a hacker actually sought out patients and threatened to release their mental health notes if they did not pay a ransom. As scary as the stories and statistics on the previous slide are, they're not anecdotal, nor are they a once-in-a-lifetime occurrence. They are harbingers of for the future if healthcare networks do not follow industry best practices when it comes to cybersecurity. The figure on your screen shows the number of breaches reported to the U.S. Office of Civil Rights, plotted against time between June 2021 and May 2023. The R squared, or the strength of the relationship, implies a very strong positive correlation between the passage of time and the number of incidences. The number of breaches does not decrease over time, and furthermore, is projected to continue increasing. As a society, as we as a society become more reliant on technology in all of our aspects of life, including healthcare, the attack rate is only going to continue to climb. Therefore, it's very important for healthcare networks to prioritize the privacy of the patient data and the security of their computer networks. There are many types of cybersecurity issues. They can be either intentional and malicious or unintentional. Cybersecurity incidents target either confidentiality, integrity, or availability. Now, this presentation is going to focus on ransomware specifically rather than other types of attacks. Ransomware, per the Cybersecurity and Infrastructure Security Agency, also known as CISA, is a malicious software or malware that's designed to encrypt data and render the files on a system unusable. Now, if a system is hit by ransomware, generally the users would see a screen that states the data requested is unavailable without a ransom. Some ransomware attacks threaten to either delete the data or release it publicly if a ransom is not paid. The federal government actually considers paying a ransom to be a criminal offense. In fact, no assurance that paying a ransom would even result in eradication of the ransomware. It would be prudent to also point out that the hackers may have already made a copy of the patient's data, and hackers are generally not to be trusted. When it comes to ransomware specifically, ransomware targets confidentiality by releasing data to unauthorized users. Ransomware targets integrity by destroying patient healthcare data. And finally, ransomware targets availability by restricting access to patient health data from authorized users or healthcare when access is needed. The most commonly used approach to disaster management involves four distinct steps per the FEMA model. The four steps are mitigation, preparedness, response, and recovery. For a healthcare provider to successfully deal with any ransomware incident, they must also use the FEMA model for a successful disaster planning process. The tactics provided in this presentation are neither exhaustive nor healthcare specific. However, they do encompass industry standard best practices for any organization's cyber disaster management plan. Mitigation encompasses a wide range of defensive measures that a healthcare system may take. Using robust antivirus and anti-malware software is the most common defense against ransomware. Installing a firewall is essential for security since it may block outsiders from even entering a private network. Segmenting a network could also prove useful in disconnecting the infected network or in disconnecting the infected computer. Data also needs to be encrypted. Preparedness include the measures to reduce vulnerability, and that's keeping systems up to date. Systems constantly need to receive patches or updates to address newfound vulnerabilities. Regular testing, auditing, and verifying that all the backups necessary, all the backups are done correctly to ensure that their availability and reliability in an emergency. Having multiple ways of authentication would also reduce unauthorized attempts. Finally, hospitals should educate their users about various cybersecurity topics like password protection practices and regularly mandate training regarding social engineering schemes like phishing. Responding to ransomware is a technical and cumbersome process. Once a ransomware attack is detected, the IT department should immediately isolate the infected system to prevent further spread. If the hospital has a segmented network, a step initiated in the mitigation step, they can then disconnect the impacted segment. This not only stops the infection from spreading to the main network, but also buys the security team extra time to locate the source of the problem and attempt to eradicate it. For cyber disasters, recovery really depends on the mitigation and preparation steps that an individual healthcare network undertook. If IT successfully isolated the impacted system, they should format and clean it of any trace of the ransomware. If the hospital invested in a robust backup system, the administrator could restore the relevant backups. If the relevant law enforcement agencies were promptly notified, then they can collect evidence to build a criminal case against the bad actors. Now, the first case study that I'm going to talk about is Common Spirit Health Systems in Illinois. Common Spirit is the second largest nonprofit healthcare network in the US with about 140 hospitals and 1,000 care sites across 21 states. In 2021, before it was hacked, the total operating revenue was $33 billion, 12.5% higher than it was in 2020. Now, the system was infected on September 16th, 2022, but it was not observed until October 2nd when IT detected quote unquote strange activity. Hospitals across 5 states were unable to access all required systems. Before IT detected the intrusion, the hackers had unfettered access for 18 days, in which personal data of 623,774 patients was accessed across 13 states. While HIPAA states that the healthcare entity must report breaches within 60 days, Common Spirit did not report the intrusion until December 1st, 2022. Common Spirit here, going by the October 2nd date, reported the breach exactly 60 days after the IT department claimed to have detected the malware, but in actuality, it was 76 days after the infection occurred. Now, it is unknown when Common Spirit actually became aware of the intrusion. Common Spirit has also been tight-lipped about how the ransomware was installed on their system. However, experts report that it came through phishing, a common email scheme that is meant to trick the user into thinking it's a legitimate email. The intruder, as I said, had access to the data for 18 days before they were caught. That means that their network security is insufficient and does not meet industry standards. If the malware was installed via phishing, as experts hypothesize, then the users were not trained properly. Moreover, the IT department allowed unauthorized access from outside the network into their internal server for more than 2 weeks. So the IT department was also not properly trained in intrusion detection. Since the infection occurred more than 2 weeks before detection, and the hospital network waited the maximum allowed days to report to HHS and the patients, one can infer that the response to the incident was not only insufficient, but also delayed. Finally, based on the quality of their response, one can surmise that the hospital either did not have an adequate cybersecurity plan or was unable to access their plan, and that they did not conduct any run-throughs or tabletop exercises. There's one thing that remains unknown, as the hospital has not been forthcoming. While they did confirm that data is encrypted when it is accessed, it's not known if the data is encrypted while it's not in motion. In other words, are the 620,000 plus records that were exfiltrated encrypted, or are they in plain text where the hackers can read them and use them in a malicious manner later? To date, the data that was stolen has not surfaced on any website or the dark web, which means the hackers are either waiting or the data is encrypted. Common Spirit is now a defendant in a class action lawsuit that alleges that they failed to exercise reasonable care with the EPHI, the Electronic Patient Health Information, that they did not employ industry standard protection measures, and that they delayed reporting to HIPAA or to the breach per HIPAA requirements. This is assuming that they knew about the breach when it occurred in September. They also, the class action lawsuit also claims that, or the Common Spirit also claims that there were $160 million in immediate losses in the system restoration, in remediation costs, business interruption, and lost revenue. Moreover, for that particular quarter, November, December of 2022, the hospital network claims a $474 million operating loss. It's also not known if there's going to be any criminal liability or any HIPAA fines, because the investigation has not been completed yet. The class action lawsuit is also still going through the court system. Regardless of the losses that I mentioned, the dollar amounts, and any potential damage to their brand's reputation, and regardless of a class action lawsuit, Common Spirit is still operating and has not reported any massive layoffs or closures due to the loss. In fact, since the breach, they have purchased 5 additional hospitals. Now, Vastaamo psychotherapy centers in Finland also reported a data breach, but had a different conclusion. Vastaamo psychotherapy centers were Finland's most extensive network of mental health practitioners. The easy-to-use interface serviced 40,000 patients. In October 2020, a hacker contacted Vastaamo management, threatening to release private patient data unless they paid a ransom. Now, the hacker accessed unencrypted PII, and some of that included medical notes and therapy session notes, some of the thoughts that patients have divulged to their therapists, such as thoughts of pedophilia, suicide attempts, addiction, and abuse. When Vastaamo heard about this ransom threat, they promptly reported the note to the authorities and their patients. An investigation found that there were actually two hacks before the ransom note was even sent, one in November 2018 and the second in March 2019. Vestamo alleges that they were unaware of the intrusion before they received the ransom note in October 2020. The investigation also found that Vestamo did not have a firewall to protect against external threats and that the patient database was exposed to the internet. Anyone with advanced Google search skills could find the database if they just Googled, just by searching for it. Worse, the database administrator's password was never changed from the default password that comes with the installation guide. Similarly to Common Spirit, Vestamo did not have sufficient security. While we don't know exactly what Common Spirit had and did not have, as the investigation is still ongoing, we know that Vestamo did not even install a firewall or protect their databases. There was no user training on basic network security, nor was there training on GDPR requirements, as this is an EU country, because the data was not even encrypted, which is a GDPR requirement. Moreover, there were two hacks that the organization was oblivious to before the hacker sent a ransom letter. Based on the results of the investigation, Vestamo did not even have a cybersecurity plan in place. Vestamo did not pay the ransom. The hacker, undeterred, began extorting the patients themselves, threatening to publish therapy notes if they did not pay him 200 euros. Many patients reported the extortion to the police, but unfortunately, some patients contemplated suicide due to the intimate nature of their therapy notes. The GDPR sanctions boards concluded their investigation and found that the acts of negligence were extremely serious and that Vestamo's was neglectful in their duties. Moreover, they were fined 608,000 euros, or about $682,000, by the GDPR. Locally, in addition, the Helsinki District Court declared the company bankrupt and disallowed them from operating anymore. The case studies that I talked about are not unique. And as shown on a previous slide near the beginning, attacks are increasing in frequency. And despite the growing frequency of cyber attacks, many healthcare institutions potentially remain unprepared to identify, avoid, or recover from cyber attacks. These attacks are unilaterally impacting both public and privately held hospital systems in the US and abroad. As with other forms of disaster, response and recovery are significantly aided by actions taken in the mitigation and preparedness phases. Some of the mitigation strategies outlined in the ransomware best practices section previously, such as antivirus software, firewalls, multi-factor authentication. These are simple strategies that hospitals can implement. Others, like segmenting a network and actively working to remove ransomware from infected devices, do require a little bit more technical expertise. When a healthcare organization underestimates the likelihood of becoming a target of a cyber attack and therefore chooses to utilize minimal to no mitigation strategies, they're exposing their patients to undue harm. Essentially, if the organization fails to plan for a disaster and a subsequent recovery, they're planning to fail. Although natural disasters can never be stopped, their effects can be lessened. Similarly, cyber criminals will keep attempting to gain access to networks to steal this treasure trove of valuable data. Organizations will make themselves fewer enticing targets for hackers by adhering to industry best practices and making the systems harder to infiltrate. Regardless of Common Spirit's practices, they clearly were not enough, as 620,000 records were exfiltrated. Now, due to the power balance in American politics, the government strongly favors corporations over the individual. because organizations rarely fail following a data breach. This appears to be regardless of the extent of damage and data loss. For example, Yahoo remains an active business despite twice losing billions of user accounts in separate hacks. Likewise, the Credit Monitoring Bureau, Equifax, admitted to losing millions of social security numbers and other PII in a costly hack. And even when they were investigated, they were found 100% at fault, and every single thing that was exploited by the hacker could have been avoided to begin with. Yet the company has recovered all the lost trust. It appears to have recovered all the lost customer trust and is still an industry leader in monitoring personal credit. Comparatively, the EU appears to place greater value on the average citizen than on corporate interest. The Vestamo hack and the resulting bankruptcy clearly demonstrate the risks of poor cyber disaster management in Europe. To protect its citizens, the US government needs to mandate minimum security standards rather than resort to vague recommendations as worded in HIPAA. Since its implementation in 2003, over 20 years ago, the Department of Human and Health Services has received over 331,000 HIPAA complaints, yet only imposed a fine in 133 cases. For comparison, EU regulators have issued over 154 fines to medical entities since 2018. Compared to HIPAA, the GDPR is a far superior protection of individual rights. It's more robust. The comprehensive data protection standards apply to all forms of PII, not just health-related information, and it just seems to be less vague than HIPAA. Meanwhile, the US lacks an equally comprehensive federal notification breach law or a federal Consumer Data Privacy Act. Apart from the health-related data that's protected by HIPAA and the financial data protected by the GLBA, the federal government defers to state-level governments to define acceptable protection levels. And these are going to vary from state to state, and they're further complicated because corporations operate across state lines. Even within the scope of HIPAA, the technical language is ambiguous and is widely open for interpretation by the covered entities. In fact, parties are only required to protect data in a fair and suitable manner. Other federal agencies, such as the FDA, Federal Drug and Food Administration, have greater oversight over their domain and can mandate specific actions which companies must comply with before their products reach the public. HHS has to adopt a similar, clearly defined approach to protecting citizens' health data and PII by incorporating minimum required standards of cybersecurity measures rather than ambiguous recommendations. As I had mentioned earlier, these recommendations are not impossible, nor are they super hard to achieve. They're easy, they're cost effective, and cybersecurity needs to be taken as a partner at every step of the way rather than thought of as an afterthought in which companies and hospitals are putting profits over cybersecurity. My references are on these next two slides, and thank you for listening.